All right, this exercise is called ramping. And what we're trying to do is make a ramp with the body, which will help strengthen the sacroiliac joint, the lumbar vertebrae, the hip extensors. Now, one of the main problems people tend to have is weak external hip musculature, and so the knees will collapse in. So, for example, when Kathy does a ramp, look for this. If the knees wobble or collapse in, you need to give them a biofeedback challenge. And that is, down you go, Kathy, you put an elastic around, lift this foot, there you go. There you go, Kathy's just getting used to her new feet. Okay, so what you want is to bring the feet together and go opposite to what the weakness is. So now Kathy's going to split her legs apart, and this is called a clam. And then I combine the clam movement, which is a physiotherapeutic exercise, with the ramp. Up you go. And that way we are now strengthening both the back part, the spine, the hip, as well as the abductors, all at once. Time management. All right, so Kathy, with your hands along your side for stability, because you're new to this exercise, we're going to use a stick as a teaching aid for you. We're going to put the stick from the shoulder to the knee, and all I want you to do is now raise your butt so that we have a ramp. That's why we call this ramping. Keep the elastic tension so that your knee and your hip is in alignment with your body. That stays there for 5 seconds, 5 seconds, allow the body to adjust, and then down again, and then up again. Don't let the person rest at the bottom for the 5 seconds, 5 reps, and down again. One more time, up. As the person gets used to this, and I mean over 1 to 2 weeks, depending on the sensitivity of the tissue, you can start to move the person sideways. You can start to put a little bit of pressure on either pelvis, as well as you can start to shake the elastic. These are all excellent action-reaction in very small movement patterns so that the spine gets used to it and gets used to slips and falls and is therefore protected.